Okay, I think we're going to get started promptly at 1 o'clock today. We've got a lot of great content that I want to make sure we have ample time for. So thank you again for joining us today. My name is Erin Bader, and I am the Director of Knowledge and Dissemination for the National Center for Adoption Confident Mental Health Services. And we are happy to have our colleagues, our case colleagues, Jane and Courtney, here to talk about NTI and our school-based curriculum. So next slide, please. As typical with any webinar, we've got some housekeeping. Just wanted to make sure you're all aware that this webinar is being recorded and will be emailed out to anyone who's registered, so even those folks who aren't able to join us live today. If you have any questions, please put them in the Q&A box. If you have any technology needs, please put that in the chat, and we've got Molly who can help you. And all of you are muted, but if you have a question, please put it in the chat, or you can raise your hand asking to be unmuted. And please do keep engaged with us and with each other in the chat. Next slide, please. So I just want to do like a very quick overview of CASE and the National Center. So CASE is the Center for Adoption Support and Education. And CASE has been the national leader focused on the mental health needs of children and families, adoptive, foster, and kinship families. And in 2023, CASE was awarded a grant from the federal government, the Children's Bureau, which created the National Center for Adoption Competent Mental Health. And to put it simply, we are working to increase access to adoption competent mental health services around the country, to build cross-system collaboration, and to train professionals, which you're going to learn about today. Next slide. So this next slide is just kind of an overview of how we advance adoption competence through various CASE programming. So you can see the National Center at the top. We do systems change work. NTI is our online training, and we have curriculums for child welfare, mental health, and our school-based, which we're going to talk about today. And NTI is another federally funded grant. And then we have the training for adoption competency, which is the foundational adoption competent training for mental health professionals. And then our CASE Academy, which allows professionals to continue their learning in adoption competence. Next slide. And you can click, there's darn animations. Thank you very much. So as I mentioned, the National Center builds cross-system collaborations. So we are working to bring mental health and child welfare systems to the tables to work together. And we use that as a mechanism to enhance the competency of both of the workforces within those systems, as well as other child serving systems, and to address the accessibility to ensure that families have access to the mental health services that they need. And that all leads to our ultimate goal, right, of having every child connected to adoption, foster care, and kinship care thriving. And now I'm going to hand it over to Jane and Courtney.
Thank you, Erin. Welcome, everybody. My name is Jane Dugan. I am the Educational Implementation and Training Specialist here at CASE. I am a former school-based therapist, so I am really passionate about what we do here. I'm going to have Courtney introduce herself, and then we will get started.
Good afternoon, everyone. My name is Courtney Jordan, and I am the other educational and training implementation specialist for the school-based training. Thank you so much for being with us this afternoon.
Going to go ahead and get started. So welcome, everybody. And again, this is in their backpack, and this is the added weight of loss and grief in for students impacted by adoption, guardianship, kinship care. And so, sorry, my screen just went blank. Hang on. There we go. Sorry about that. So we're going to go to the next screen. So, a little overview of what we're doing today. We are obviously going to talk about the impact of loss and grief in students experiencing kinship care, adoption, foster care. But not only that, we're going to talk about the why behind this training, why it's so important that adoption competency and permanency is implemented in our school systems. Some of the challenges, we're going to define ambiguous loss. We are going to recognize the signs of disenfranchised grief in schools. We're going to talk a little bit about trauma informed and how to bring in community partners and families and how to implement this training into our school systems and into our family systems. So with that being said, so I like to start kind of every workshop presentation with addressing what is your connection to adoption, foster care, kinship care. I'll start with my own story. My family of origin was formed through both my parents having biological children as well as adopting 7 or 8 children. I said 7 or 8, it's definitely 8. And through that process as a family, we found it really challenging to find support, to find competent help, to find anyone who had knowledge in this realm. And in doing so, my parents hit a lot of different walls. Then they met Debbie Riley, who is our current CEO and founder of CASE, and the three of them created the Center for Adoption Support and Education. So that is my connection to adoption. I'm just curious as to everyone else's. Please feel free to put it in the chat. We can take a look if you would like to share. Okay, we have a CASA, supporting mental health needs, adoptive and foster families, adopted myself, therapist for foster care, prevention worker in Fairfax County, love it, grandparents, district foster youth liaison, love that, adoption, somebody is an adoptee, foster parent, so many different realms here. I'm super excited. 2 sibling foster children, post-adopt social worker, public health worker. That's awesome. Thank you guys. Appreciate that. Next slide. Thanks. So Erin did a good job of talking about CASE, but I will reiterate at the Center for Adoption Support and Education, we work across every level of the permanence ecosystem to ensure that families stay together and thrive. Our vision is a world where every child and family connected to adoption, foster, and kinship care can thrive. And Erin already went over this, so we're going to keep it going. So what we do here at CASE, we provide direct clinical services in the Maryland, DC, Virginia area. Then we have another branch in which we do training and education, which is obviously where Courtney and I fall under. And then we have a systems change, and they work at building bridges between the child welfare and mental health systems so as to remove barriers that stand between families and the care that they need. So why this training? Why this training matters? Why is this important? Well, first and foremost, it's understanding the unique needs of this population. Our kids spend the majority of their time in the school systems. So our goal is to implement this training into, we would love nationwide, worldwide school systems to have a better understanding of the unique needs of this population. Next, it's to provide support and education to other members of your staff and community. I know there are parents on here, so advocating for your students. If you work in the school system, it's educating your staff, the teachers, admin, superintendents, mental health providers. Again, it's about educating the people around you. Next, it's to address the trauma, disenfranchised, grief, and ambiguous loss. So really educating everybody about what that looks like. Inclusivity, of course, for all of our students. And then also we're going to provide tools, resources, and strategies that promote social emotional growth and academic success. So I'm sure it's no surprise to anyone that we are in a mental health crisis here, and this is impacting our students and their academic achievements. So post-COVID, the mental health crisis increased pretty significantly, especially in females, according to the CDC. On top of the normal struggles, children and youth are experiencing increased anxiety, depression, loneliness, coping with stress, and youth who are experiencing adoption, foster, and kinship care have elevated issues that impact development, social emotional regulations, and academics. So on top of the normal anxieties and symptoms that are happening across our world, our students who are experiencing adoption, foster, and kinship care really have some different levels of the same kind of issues that impact their academics and regulation. So educational challenges for youth in foster care. So currently there's a little more than 420,000 youth in care in the United States. And with that being said, 70% of the school-aged youth are in schools. So they're school age. So we're talking 4 and 5 through 18, 19. And so for a whole host of different reasons, education suffers. And some of that is because of the education instability. Children in foster care have multiple placements. They change schools frequently, which leads to less academic success. Oftentimes, teachers, admin, counselors aren't even aware of how many moves their students have made. And this results in challenges creating both meaningful relationships, academics. It creates some other issues such as lowered standardized tests, higher absentee rates. Because of court dates, visits, we have higher tardy rates, more likely to drop out, and higher rates of school suspension and expulsion. With this education and training, we can improve outcomes for our students. First of all, we promote early support. So really identifying mental health needs through early screening and observation. We can create safe, supportive environments for our students, and we provide resources and tools and strategies to better support our students within these environments. So creating stable adult relationships. We want trauma-informed classroom responses and flexible alternatives to family-centered assignments, assignments like family tree assignments and things of that nature. We can improve by teaching coping skills. Not only teaching them to our students, but teaching them to our teachers, our admin, our school counselors as well. And then, of course, normalizing mental health conversations. We want to be able to talk openly about mental health in order to reduce some of the stigma and encourage seeking help. So, what is one challenge that youth in foster, kinship, adoptees, and kinship care face in school or community settings? For any of you that work within school settings, anybody who wants to kind of put in the chat, what are some of the issues that we are seeing? I'm going to read the chat. Yep, old discipline methods, correct. Thank you. We're also looking at some of the why is this kid acting like this as opposed to what happened to this child. And so I was working as a school counselor in a suburb outside of Denver, and there was a group home that kind of filtered into our school, and I had easily 8 to 10 students who were involved with the Department of Health, DHS, and not having known about this training or taken any of the training, had I known about this, there would have been just such a different outcome. Now, with that said, I didn't create any harm, thankfully. But knowing what I know now about grief and loss and the impact of trauma, it would have made a big difference in how I approached not only my clients, but also the teachers within the school community as well. So we're going to go on. Thanks. So educational outcomes for youth in foster care. I won't go over all these statistics, but some of these really stick out. So as far as school stability, I talked about there's students are changing schools on the average of maybe 5 or more times. And I always like to reference this as think about us as adults and think about a time where you had a big change, whether that was a move. I moved cross country 2 years ago, not an easy feat. Think about changing jobs. Think about just a change in your routine and how that impacts your social emotional well-being. And we're talking about on the average, almost 34% of 17 and 18-year-olds who are in care have had to change schools 5 or more times. That's too much. And the social emotional impact on this is not great. So school engagement, we're talking about youth in care having more out of school suspensions, higher tardy rates. We're talking about 50% of youth in foster care receiving special education services. So that's pretty significant. There's a slightly lower high school graduation rate, and then post-secondary, about 10% of foster youth obtain a bachelor's degree. So some of these statistics we are working on changing through this program. Thank you. So adoption is a powerful human experience with unique issues, both for adoptive individuals and the birth and adoptive families. Adoption touches on universal themes of creating life, abandonment, and loss, personal identity, a sense of belonging. And this is a lifelong journey. This is not something that, we're going to learn some statistics, work with a client, and boom, everything is different. This is a lifelong journey. And so in today's world, the experience of family is evolving all the time. Family relationships can be complicated, and families that come together through foster care, through guardianship or kinship and adoption often experience added layers that make things a little more complex. So with that being said, studies have shown that students experience elevated risks for developmental, emotional, physical, educational, and behavioral challenges due to traumatic life experiences and compromised beginnings. It's important as people working not only with students and their families, but also with the bigger community. It's important to understand these complexities, including how this impacts identity, how language can impact these students, and of course, loss and disenfranchised grief. So what is identity and why does it matter? So a simple definition is it's the concept you develop about yourself that evolves over the course of your life, who you are as an individual, where you fit in within family relationships, and within which social groups you fit in. So along the developmental continuum of a child's identity formation, it can be impacted by those early experiences and some of those early traumatic events, which might look like having to look at the attachment history, having to look at and realize that some of our students have large gaps of information about themselves and their past that they're not aware of. There's a stigma of adoption in guardianship or kinship care, which could lead to bullying, leads to not having that connection with your peers, and then leads to asking those questions, who am I? And not having, all of these factors are the important part of identity formation. And when we don't know, it would be setting the stage sometimes for troubling behaviors. So that stronger foundation of positive identity and sense of self-worth as a child or youth the more likely they are to overcome some of these barriers. So we're talking about why identity matters, and now we're going to talk about why language matters. The language we use matters. For students impacted by adoption, fostering, kinship care, language can either validate their experiences or unintentionally reinforce shame, reinforce stigmas, or even some misunderstandings. Language reflects mindset. So when we change our language, we often change how we see our students and how that changes and how we respond to them. So appropriate language in adoption should and is person-centered and respectful. So recognizing that a person's identity is more than their adoption status, using, instead of saying, who are your real parents, which oftentimes people say, we use birth parents, we use first parents, or we simply just say parents when referring to adoptive parents. And this reinforces that, that all families are real and valid. So appropriate language in adoption, it acknowledges loss and grief. So every adoption begins with a loss, even in loving, successful families. Using language that recognizes this experience helps children and families feel understood. And so an example of that, instead of saying she was given up, we say she was placed for adoption or there was an adoption plan. So language should avoid assigning blame or oversimplifying complex situations. Next, it builds trust. Our students notice when adults use language that minimizes or misunderstands their experiences. And so when educators, when our communities, when our mental health professionals use thoughtful, adoption competent language, they're communicating, I understand, I get it. Your story is respected. It supports identity development. Children who have experienced adoption, foster care, kinship care often navigate questions about identity and belonging. So rather than asking, do you know your real mom? An adoption competent question might be, would you like to tell me about your birth family or tell me about your family? And this allows our students to kind of define their own relationships. Finally, it influences educational and mental health outcomes. So language affects how professionals interpret behavior and make decisions. So just having that knowledge of the appropriate language. And this slide will be in your, we will offer you a school kit after this presentation. So we're going to go on to the next slide. Sorry, can we go back to you don't know what you don't know? One back. Nope, sorry, forward. Love technology, y'all. Okay. So we're going to play a little clip from our training about why adoption competency and why it's important.
Well, as someone who's been involved in training clinicians around adoption and foster care issues for a long time, it's probably 25 to 30 years now. One of the things that I've come to learn is that most clinicians don't know what they don't know. They get good training typically, that they may well be excellent clinicians, but the complexities that adoptive families face are not taught in graduate school. Adoption is not a topic that typically is part of a clinical curriculum, even in social work, a little bit here and there, but the complexities, no. So one of the things that is important for them to realize is the sheer nature of what adoption is, the process involved, the complexities that these families face in becoming parents, what the child has been through as they have been moved either voluntarily or not from the biological family into sometimes foster families and another foster family and then another foster family and finally end up into an adoptive home, or what it's like for a child who grows up for the first year or so in an orphanage where they experience congregate care, but not really one-on-one parent-child care, and then enter their adoptive family. So there's so much in the dynamics of adoption that's critical for clinicians to know about that they simply don't have training in. There's no question in my mind that clinicians, if they want to be adoption competent clinicians, need to have specialized training. There's a body of knowledge that needs to be integrated together for them to be able to approach these families in not only clinically effective ways, but sensitive ways, understanding what these families have gone through, understanding what the children have gone through. I think parents very often are aware when they're working with someone who's adoption competent. They sense the empathy of the clinician with regard to what they've gone through. The children sense an empathy for what they've gone through. There has been a lot of families that I've worked with over the years that have come to me after working with other clinicians who they've been very dissatisfied with. Sometimes they've been given information that they feel has been simply wrong, sometimes insulting. Sometimes the clinicians have gone so far as to say, well, why don't you return the child to the agency? A comment that doesn't represent knowledge of the adoption process.
And that ties us back to the why piece, the why we do this and why it's important. Can we go back to slide core issues and guiding principles? It's one behind this slide. Thank you. So our work here at CASE is grounded in principles based on the core issues of adoption, which we believe are essential to supporting children and youth in foster, adoptive, and kinship families. A few of our guiding principles, but not all, include adoption has a lifelong impact. Not knowing who you are or where you come from can lead to challenges. Some of that leads to depression, identity confusion, and some emotional distress. And if unresolved, these issues often persist into adulthood. Another core issue and guiding principle is loss is at the heart of every placement. Every adoption, foster, kinship care experience begins with a loss, which should and must be acknowledged to promote healing. Next, children and youth should never have to change who they are to belong to a family. And then with that being said, we're going to move on to talking about loss and what that looks like and how that impacts our students. And so there we go. Thank you. So as mentioned before, loss is at the heart of every adoption or placement. And so because loss is a common experience, people come to expect and really want to receive acknowledgement and support in their grieving process. And some of those losses are less clearly defined or understood and are less likely to be recognized. And this is the case for those whose lives have been touched by adoption, foster, or kinship care. So loss associated with adoption and guardianship is often sometimes minimized by caregivers or by others because the focus is usually on what our children, what our students and youth have gained through placement in their families. So oftentimes it's stability, it's safety, it's permanence. But it's also overlooking sometimes that piece that's the loss. So it's imperative to understand that every child and youth is different and how they understand their adoption or guardianship placement. So for one child, removal from birth parent may be traumatic, but for another, it's a huge relief. And so understanding that piece in the loss. So we talk about this idea of ambiguous loss and disenfranchised grief. So ambiguous loss is this idea that there is this loss, but oftentimes we can't touch on what it is. And so for those students and children or youth who have lost are likely, those people they have lost are likely to be living, which makes it hard to accept the finality of the loss. It's also the adopted person's grief is typically, or sometimes I will say, not acknowledged or supported by others. And oftentimes we do acknowledge when we have, if we're talking about our school settings, we have students who have experienced death of grandparents, death of family members. and the community kind of rallies around them, and we recognize that loss and we recognize the student's experience and how hard that must be. But more times than not, we don't always recognize the loss of our students experiencing adoption, foster, and guardianship. And just because students may be placed with a grandparent or aunt, uncle, new home, doesn't mean that there's not that significant loss. And so ambiguous loss is a loss that occurs without closure or clear understanding, such as when a parent is alive but absent. So oftentimes our students and our youth are misdiagnosed. Most likely than not, symptoms being demonstrated are related to this idea of complex grief and loss and trauma responses from that, as opposed to ADD, ADHD, some of those bigger diagnoses. And this idea of ambiguous loss really complicates the grief process in that it makes it harder to grieve, leading to some unresolved emotional distress. It can create a sense of stuckness in that if we talk about moving through like the stages of grief, if we aren't acknowledging what it is that's at the core of this, which is this kind of idea of ambiguous loss, then there isn't a lot of movement there. And so there is this stuck piece. It also impacts academic performance. It impacts our students' focus, emotional regulation, harder to connect to trusted adults or even peers. Gonna go on. Okay, so we recognize signs of disenfranchised grief. So disenfranchised grief is unrecognized or minimized. And we kind of used this example earlier, but you should be so grateful. You're safe now. You should be so grateful you're in a new home. It leaves our students and our kids feeling unseen and unsupported. And so how does this show up? It shows up in academic decline, in that our students have trouble concentrating. There's sometimes a drop in grades. There's a loss of interest in schoolwork. There's behavioral changes that a grieving student might become withdrawn, irritable, unusually dependent on adults, or the opposite, pulling away from the trusted adults. And others may act out, whether that looks like disciplinary issues or just withdrawing from academics, withdrawing from peers. And oftentimes that leads to some of the bigger disciplinary issues if the underlying kind of issues aren't understood appropriately. I'm now going to pass it over to Courtney to do an exercise and finish up with the rest of the presentation.
Thank you, Jane. I am going to finish the conversation about grief and loss as it relates to students who have life experiences with adoption, kinship, and foster care. So I was a school counselor in DC for 17 years, and where I found a lot of school districts have a small population of students that fall under adoption, foster care, and kinship. By no means was that my story. I had a lot of students that dealt with grief and loss. And even though I met them with a lot of empathy, I truly wish that I had known about what this training entails, because I could have met them with a lot more intentionality. So you'll hear me talk, give like little nuggets as we go about with my experience, because I think it's really important to be able to tie what this training does with how it translates in the schools. So I want you to kind of put on your 10-year-old brain or think back when you were 10 years old. And I want to start with a scenario. So imagine that you're 10 years old and you're living in foster care. You're unexpectedly picked up from your school and you're told you cannot return to the foster home. You can only take 10 items with you and there's no exceptions. So as a 10-year-old child, it's really hard to process that in the moment, because you're trying to rattle your brain, like, what is in the home? What's important? I don't want to forget anything. And at 10, we really don't have the regulation and the skills to kind of figure out what is priority. Even as an adult, that would be very hard for us because we may have like multiple children. Like, who do you leave behind? Our fur babies. There's so many like heirlooms. There's so many things that we want to take with us. And I feel like this exercise is really important because it just gives you a little bit of a glimpse of what some of our students endure when we're talking about transitioning from one home to the next. And even though we have something similar that's in our training, I want to share that this scenario happened to me when I was a school counselor. I had a young man who had an incident the night before, and I got an email from his caseworker saying that he had to be moved from the group home and that he needed to tell them what was his to take. And that was a really hard conversation to have with him because, he was upset first. I didn't do anything. I was attacked. Why do I have to leave? And once again, there's something that just doesn't feel justified or fair that a lot of our students in these situations have to endure. So through the eyes of the child, and that's what most of my presentation, part of my presentation will be. Jane talked about systemic, and I will talk about the lens through a child's eyes. So what did you choose first? Some of you may have, like I said, chosen your children, but as a child, you have like your Xbox, you have your phone, you have a teddy bear, you may have a necklace that mom gave you, bio mom gave you. You may have pictures of you going to a baseball game with a previous foster parent. So that's really hard to figure out what you choose first. What did you regret leaving? Because of 10 things, you can't take everything. So how does that impact? And also, I think it's important to talk about that this is just not about selecting items, but even more so about the emotional toll that comes up when you're trying to select. What about the time? If someone's telling you, come on, you gotta wrap it up, you gotta finish it. You don't even have time to process for some things that are so dear to you. What emotions come up? Like, is it frustration? Is it anger? Is it sadness? Is it confusion? How might repeated moves affect a child? This might not be their first rodeo with this. So in their mind, like, here I go again. And they were really hoping that this place really stuck, right? Like they were hoping that they didn't have to transition to another home. And what can supportive adults do differently? This is where I truly felt I could have had a lot more impact on my student advocacy. Advocacy. And that's something that we'll talk about later on how we make a difference in these students' lives. So addressing complex trauma. Complex trauma is something that we know that a lot of the students that are experiencing adoption, foster, and kinship care, they endure. And there are many different types of complex trauma. So what is the definition? So complex trauma happens when a student experiences multiple and repeated or long-term traumatic events, often started in childhood. And it doesn't have to be isolated, right? So there could be traumatic events that just happen one time, and there could be another traumatic events that repeatedly happens. And what are the examples? The emotional, the physical, the sexual. What about the neglect? What about the exposure to violence? Often all of these things have an impact on the trust of adults and relationships. We could have the student that's very recluse, they don't interact with the other students, or we can have that one student that is extremely clingy. All of that could be a result of the traumatic trauma, the complex trauma that they have endured. What about emotional regulation? They just don't know how to deal with these big feelings. So for a smaller child, it may be temper tantrums. For an older child, it may be storming out of the classroom. And it's not because that they don't know of what happened. It's that they really don't know how to regulate the emotion. And it comes in like not what happened to the child, but what are the things that are really impacting them here and now. That's so important. Trouble concentrating and learning. If you went through some of these things, the last thing that you really want to do is go into school and be able to concentrate or do your work. Complex trauma is really tricky because it's full of triggers. So you just really don't know when a trigger is going to hit you. And also, some of our students, when we talk about violence, what did they endure the night before? Were they waking up by gunfire? Were they waking up by domestic violence? And to expect the child to come in and just be so attentive, that's a little tricky because we want them to receive their education, but we have to take into account all the things that they are experiencing. Anxiety, depression, and low self-esteem are absolutely examples of the abuse, the neglect, and exposure of violence that we're talking about. So you will hear me reference backpacks a lot, and you heard Jane do so. And, I want you to think about this, not only the physical backpack that students carry, but I want you to think about the invisible one that we don't even see. What does that contain, right? That contains the loss, that contains the grief, that contains the caretaker changes that they've gone through, that contains the different homes they've been in, the different friends they've had to make over the last years that they no longer have contact with. So when we talk about the backpack overflowing, there's the emotional signs, there are the behavioral signs, and there are the academic. In terms of anger, we can see that they are just don't know how to regulate, and they become, angry with things that maybe people see small, but to them, it's really big, and they just don't know how to regulate that. The shutdown, as I spoke about, the child that is really recluse, that just does not want to entertain company or doesn't want to be in the groups that may be assigned by the teacher. The withdrawal. I don't want to get too close because I have no idea when this school may be just one of the many that I may have to attend. So I'm going to withdraw. I'm going to go in my safe space, and I'm not going to interact in the way that I know would probably be helpful. The behavioral signs, the defiance, the acting out, and the overreacting, right? And that can show that these students really don't know how to deal with these big feelings, and they're trying their best to show like something is really wrong. There's something inside that I really don't know how to express, but I really need someone to show up because once again, my backpack is really overflowing. Academic, the poor focus, the absenteeism, the isolation. And let me say this, the backpack could be ingrained with other people, the responsibilities, like, we're in kinship care and grandma isn't able to afford food. So I have to work at night in order. That can make the backpack overflow. Or the absenteeism, where I have to make sure that my siblings get to school on time before I take 2 buses to get to school. That absolutely can make the backpack overflow as well. So the impact of loss on school-age children, and we decided to break this up where we talk about 6 through 12 ages and 13 through 18. So a lot of times in this stage, the students that have experience in foster care, kinship care, and adoption, they're learning difficulties. We see a lot of times where they're getting the 504s and the IEPs, and not saying that those are not supports that are needed, but those are very much diagnosed during this time. And we see that grief and loss has a huge impact on how students learn. That complex trauma is a big part of this. Daydreaming about birth families. The students that may know their birth families and may not, right? They may have great memories of, making Sunday breakfast with mom or going to the park with bio dad. And then the students that have never met their birth parents, they're trying to figure out, like, what do they look like? Like, how would my life be different. So daydreaming is something that takes up a considerable amount of time for students during this age range. Emotionally withdrawn from caregivers. Once again, I'm not going to get too close. I'm going to stay at arm's length because I'm not sure what the permanency looks like with this caregiver. So the impact of loss of adolescence. Working in a high school as a school counselor, I had a lot of experience with this, especially with my juniors and seniors, because I commend the states that have done great legislation to make sure that the students have a plan. Like we're talking about the transitional housing, the traditional care, but there's some that just don't have it. So these students know when I get 18, once I graduate, it's time for me to go. And some of them may not have a plan. They may be living in a home with someone that does not have the knowledge of how to get to college, how to pick up a trade, how to enter the workforce, or something that I really am passionate about. So there's a lot of anxiety around this and a lot of conversation that needs to be had, because once again, I'm transitioning. That's another loss that I'm experiencing. Also, grief may resemble clinical depression. A lot of people don't consider what grief and loss looks like, right? And so it's about putting the label, and that label very much may be not what they need, right? It may be rooted in grief and loss, but it does have the same symptoms as what clinically depressed individuals may be going through. Breakups, conflicts, as it relates to previous losses. We know that this age range, we're kind of up and down. We're trying to figure out romantic relationships. We're trying to figure out friendship. It's very complex, but it can be very triggering to the experiences that they've had in the past. So how do we lighten this load for these students, right? So if we can get our social workers to adjust the straps, what does that mean? Making sure that the students have the support they need, and that might be designating a mentor. It may be contacting an outside organization to see if they can participate in a Saturday enrichment program. That's helping to adjust the straps. School counselors, what can they do? Redistribute the weight. So I know that I have some students that are having a really hard time immersing themselves in the culture. So maybe I need to invite them to an extracurricular activity or club, or maybe I need to have a small group session during lunch where they can come in and meet people that will help them redistribute the weight so it doesn't feel so heavy that everything is falling on them. And what can school leaders do, right? We can make sure that we have environments that are conducive for everybody. Jane talked about the proper language, making sure that we say caretakers or guardians, and try not to use the language such as parents, because we want all of our students to feel really included in their school environment. So what can you do? You can create safe spaces. One of my biggest accomplishments as a school counselor, and I know we have people all around the country on this webinar, but I was in Washington, D.C. in the Deanwood community, and it was full of young men. And I had an idea, being a country girl from North Carolina, that I am going to start a farm. Now, if you know anything about Deanwood, it is definitely not conducive for a farm. So when I approached DCPS with it, they were like, no, Courtney, that's not going to work. But I had a vision. We had a courtyard that had overgrown vegetation. So once again, I found a grant. We got goats and we got chickens. And when I say this was the best space, and students that had been very recluse, did not want anything to do, they were absolutely there to feed the goats and the chickens. And they were there to mend the vegetable beds. And it was such an amazing experience. That is what we need educators to do about thinking outside the box and creating safe spaces that are very unconventional, because as I know from my experience, it makes a world of a difference for students. Creating group support for students that focuses on stages of grief. Be the facilitator, but allow the support to come from their peers. Allow them to manage their own relationships and build relationships where they feel a lot more comfortable. Educate members of the staff, admin, or community about symptoms of grief and loss. This is a big one. If we all can be on the same page, it's very helpful. We go to different school districts around the country, and what we do know, if everyone is on the same page, it makes a big difference of how we're able to structure and make sure that the students are getting exactly what they need. And in creating individual plans, it's not cookie cutter. Everyone has their own stage of grief and loss they're in. Everyone has a different definition. So making sure that we are mindful that everyone is different is so important. So Jane and I and our marketing communication director, Karen, had this idea that we wanted to create this toolkit. And it's something that you'll be getting at the end of this session. And it's filled with wonderful tools. And I'm just going to briefly describe two of them. So this is a zone of regulation. And this is something that you can use in your classrooms, or also school counselors and school social workers, about how to get to this green zone. This is where we want the kids to be, right here. And it's just talking about strategies that allow them, if they're in the blue zone, how to get to the green zone. If they're in the red, get to the green. And this is debunking the myth that some emotions are bad. There's no bad emotions. They're just ones that will put you in a better space. And this is what this tool allows educators to do. And this is another one, managing change in school. Transition, we know, can be very, very hard on students that are experiencing adoption, kinship, and foster care. And having a routine makes the world of difference. Knowing, like in the morning, we go to bathroom break, then we're going to wash our hands and we're going to do centers. That makes a difference. And so the thought about this is predictability, connection, and preparation equals school and student success. So who can benefit from this great training? We have homeless liaisons, professional school counselors, school districts, leaders, and we even have had superintendents take this training. So when you think about who works with students, they would be a perfect fit to understand the needs of loss and grief and how they can support the student. So just a few notable achievements. I'm not going to read them all, but I think that, this shows how much passion we have for this, that we're reaching over 1,700 people that are currently enrolled in our training. We're in 48 of the 50 states, and we've even been able to write articles in pretty good publications that talk about why this training is so important. And as implementation specialists, there are lots of things that we can provide you. We can provide you with coaching. We can help you build cohorts. We can do in-person trainings. We just got back from Tampa talking to over 200 social workers in their district, and can figure out what is the best fit of this training for your district or your school. So this is a quote from one of our school counselors, and I think it's the sentiment of most people that take our training. And she just talks about how the training helped her progress with the student, and she had been working with them for years. So being able to take the tools and implement them, and how much it helped her with making progress with the student. So thank you so much. I really enjoyed explaining about our training. As I said, we are going to include the toolkit in the chat. And if you can go back, like go 2 slides forward, please. There you go, right there. And these are me and Jane's email addresses and our contact information. And we would love to hear from you to be able to go into your schools and help you implement this amazing training. So thank you so much for your attention.
Thank you, Jane and Courtney. What a wealth of information. And we will send out the slide deck for all of you. We have a few minutes left, so I just wanted to go through some resources. And again, you'll get the links to all of these resources in the slide deck when we email it out. But so the National Center on our website has a knowledge hub that has over 700 resources related to various topics, adoption competence, obviously, building cross-system collaboration. There's a section for parenting resources, peer support, kinship care, a variety of other topics. So I just pulled out some key resources that I thought were most relevant to today's webinar and to this audience. So when you do get the slide deck, I hope you take a look. Next slide. And then one more. So the last thing I wanted to leave you with is we, Courtney and Jane and others at CASE are working to train professionals to be adoption competent. And then when we get mental health professionals trained, we feature them in our national directory. So for those of you that have the opportunity to refer families or to help connect families to mental health services, this is a great place for you to start. You can search by state, and then you can see if the provider has completed the NTI curriculum or the training for adoption competency. But if they're in the directory, that's a good person for you to refer families to. Next slide. So I did see that the link got put in the chat, but please take a minute or so. It's a very short survey to complete the survey about today's webinar. We meet every month to review the results to improve, and we're always trying to improve these webinars and would love to hear your opinions. And then there's the link to our website. And if you have any questions about the National Center, you can contact Mary. And then my last request would be that you sign up for our emails. We send out maybe 1 or 2 a month. One of which is on a quarterly basis, we send out an Adoption Competent Network newsletter, which covers kind of NTI, the National Center work, the Academy, and the training for adoption competency. So it helps you kind of keep your finger on the pulse of the work that we're doing here at CASE. And that is it. So please, if you want to stay on like a minute, we'll leave the webinar open so you can complete the survey. We have found that people are more likely to complete it while they're on the webinar, because otherwise we get busy and we forget. But thank you for being here today. And thank you again to Jane and Courtney for presenting. Have a great rest of the day.